Indiana hospitals are feeling the effects of rising costs and an unprecedented workforce crisis. That's according to a new survey from the Indiana Hospital Association. 7 Indiana-based health systems responded to the survey. Since the start of last year, the health systems report suffering financial losses totaling about $3 billion. Now, hospitals are spending more to hire travel nurses and retain critical staff and paying more for drugs and supplies. We're joined now by Brian Tabor, the president of the Indiana Hospital Association, which conducted the survey. Welcome to the show, Brian.
Thank you for having me.
So your survey mentions rising costs as being the big factor. What are some of those, and are they part of the broader inflation happening globally?
You know, a little bit of it is related to the broader inflationary pressures, so supplies, for example. Some of it's related to new drugs and therapies that are coming onto the market that obviously have a lot of value to patients. But the biggest area is in labor. Hospital services are very labor intensive, usually 60% or more for the typical hospital. And it's really the incredible shortage of highly trained healthcare workers that's driving an incredibly unprecedented level of labor cost increases.
So what kind of effect will rising costs have on hospitals? You know, they've been dealing with the pandemic for 3 years.
Well, it presents some difficult choices. You know, government payments are relatively flat. We're being very mindful of affordability concerns when it comes to any costs that might be passed along. But this is a difficult environment, and I think it does present some hospitals with difficult choices about, you know, perhaps reducing certain services, and hopefully not much more than that. But it's gonna make some tough decisions for sure.
Are you concerned about some hospitals being forced to close their doors, especially smaller, maybe rural hospitals?
I am, and I don't know that it would only be potentially limited to smaller hospitals. We haven't had a hospital closure in Indiana before recently until it was 2019 was the last one. But this is a much more difficult environment. Also, I was in Ohio earlier this week, and they're really feeling the effects of these current pressures on hospitals. We saw Ohio hospitals have reduced jobs by about 2,000 just over the last couple of months, and we've seen 3 hospitals close, one of those in the Cleveland area. So I hope that's not a sign of things to come here, but there are warning signs around the country.
And, you know, you think, you know, well, what would that mean for patient health care? You know, if all of a sudden the nearest hospital is, you know, a half hour away, I mean, you're talking, I mean, that's not good.
No, it's not good. I mean, being close to world-class care is always, you know, what we want for every patient. The reality is that's not always possible. So what we've been doing in healthcare is really trying to invest even outside of the hospital and putting more resources into smaller communities, meeting patients where they are. The challenge we have now is not only just potentially the closure of a larger facility, but it also limits our ability for hospitals and health systems to invest in those other sites of care that would potentially, you know, eliminate some of the risk that you have when you have longer distances to travel. So it's really limiting in both manners.
Brian, again, thanks so much for your time. Appreciate it.
Thanks for having me.